This is Wrist Extension Goniometry by Ryan Jarima, Jamie Wilt, and Nicole Boucher.
At the wrist, there is 60 to 70 degrees of extension. This is due to a dorsal roll and palmar glide that's caused by a convex surface moving on a concave surface.
As you can see here, the bony anatomy of the wrist consists of the radius as a concave surface, and then the triquetrum, lunate, and scaphoid all form a convex surface to produce the convex on concave motion in an open chain. And of course it would be the opposite in a closed chain motion. The primary muscles of wrist extension include the extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris. This is due to these muscles only crossing at the wrist joint. The secondary extensors include extensor digitorum, extensor indicis, extensor digiti minimi, and the extensor pollicis longus. These muscles cross other joints and therefore can become actively or passively insufficient. Indications for wrist extension include when a patient has generalized pain to the area, a decrease in range of motion, following a period of immobilization, or also following a musculoskeletal injury. It is important to test wrist extension when a patient is citing carpal tunnel-like syndromes, because that is an indicator that they are affected anteriorly and restricted in the carpal tunnel of the wrist.
Contraindications for wrist extension include dislocation at the wrist joint and myositis ossificans. MO is where bone forms in the muscle. Precautions should be taken when performing wrist extension when there is an infection or inflammatory condition, when the wrist is acutely post-op, if there's an unhealed fracture or osteoporosis, carcinoma of the bone, also with hypermobility and significant pain. You should be cautious when performing this movement. In addition, caution should be taken with hemophilia, hematomas, and acute muscular injury. Reliability is the repeatability of a measurement. For wrist extension, changes in range of motion should exceed 5 degrees to be clinically significant. Also, a study found that universal GONI is better than a joint-specific device. In addition, another article found that the mean difference between successive measurements by skilled testers of wrist extension was 0.9 degrees, so that's pretty reliable. Also, the mean error for visualization compared to goniometry was 12.8 degrees and 7.8 degrees respectively. So overall, it's a reliable measurement. Validity describes whether a test measures what it's supposed to measure. For wrist extension, range of motion was proven to have a correlation on 3 of the tasks on the Jebsen test of hand function. Also, wrist extension was the second most sensitive clinical indicator of return to wrist function following an injury. So it is a valid measure to be used. When measuring wrist extension, the patient should be seated next to a plinth with their arm resting on the plinth. The elbow should be at 90 degrees of flexion, and the hand should be pronated and resting at the edge of the table. You should cue your patient to relax their fingers during the measurements, and you as a therapist should stabilize proximal to the wrist joint. To see the patient's active range of motion, have the patient actively extend their wrist while you're stabilizing their forearm. For passive range of motion, apply pressure along metacarpal heads with a thumb. Visualize both motions, and then you're going to repeat this with the goniometer to get our measurements. To measure wrist extension, the fulcrum of the goniometer will be lined up with the triquetrum or the lateral joint line. The stationary arm is going to line up with the lateral midline of the ulna, and you can use the olecranon and the ulnar styloid process as a reference. And then finally, the distal arm is going to line up with the lateral midline of the 5th metacarpal. Again, normal range of motion for wrist extension is 60 to 70 degrees. Now we will demonstrate the measurement of wrist extension on a patient.
Hi. Today we're going to demonstrate how to measure wrist extension using a goniometer. So first things first is you're going to ask your patient to, first of all, get in the optimal test measuring position. So if I could have you put your elbow on this table here. The most important aspect of the patient positioning is that they have a 90 degrees of elbow flexion angle. It puts the wrist extensors in a neutral position to make sure that you have a valid measuring. Instructions to the patient would be, what I would like you to do is move your hand closer to your elbow joint like that. You know, as demonstrated for them, I think that's a very effective means of doing so. And then the only other things that you can really instruct on is to just let your other joints, such as your fingers, to be as relaxed as possible throughout this process. And then the other aspect that you want to explain to them is also what they might feel. You might feel a stretch along the palmar side of the hand. They also might feel a little pressure in the dorsum or back of the hand there. So you want to instruct them that you might have a little pressure pain here, a little stretching in front, but there shouldn't be any exaggerated pain, nothing that's going to make you too much not uncomfortable. Okay? So now we're going to go on to the actual measurement. So first thing you do is you want to stabilize. I like 2 fingers on the top of the radial and ulnar shafts. That prevents supination and pronation. So then I'm going to ask you to, once again, bring your hand towards your elbow joint. Perfect. You just want to kind of look at, so our fulcrum to review from the slideshow is going to be the triquetrum. Then you're going to have the shaft of the ulna up to the olecranon process and the shaft of the 5th metacarpal for the movable arm, stationary arm is the olecranon. So then you're going to visually confirm, okay, it's about 70 degrees, I'd say, give or take. And then ask her to relax. And then I'm going to come in, and I like to use the table as support, and then also just kind of come with your thumb and go across the radial or the metacarpal heads, and still I'm stabilizing with all 3 fingers here. And right there I do feel a firm end feel, so that's where I would measure. Any pain with that at all?
No.
Okay, perfect. So now we're going to go into the actual goniometric assessment. I'm going to come in and set my goniometer right at 70 degrees, because that's where I thought it was. You see 70 right there. So then I'd ask her to, one more time, just while I'm stabilizing, to bring your hand back towards your elbow, please. One special note about this is don't just lay the goniometer down on the table. You need to still line it up with the shaft. It's going to be off by a few degrees if you didn't do that. And remember, 5 degrees is clinically significant on this test. So you're going to once again palpate for that triquetrum, just distal to the ulnar stylar process. You're going to come in and line up with the metacarpals. My fulcrum's lined up right over the triquetrum. And as you can see, I'm lined up right with the shaft of her ulna. And so I can see from here that she does have right at 70 degrees. It's right on the money there. And you confirm. Usually you don't want to plaster the goniometer on because you might be corrupting your results if you did that. But for this instance, I'm just moving my hand out of the way just so the video can demonstrate the reading. And then for the passive range of motion, pretty much the same thing, except you're going to come in and just have her relax again, relax your fingers, everything like that. And you're just going to disperse that load of force across her metacarpal heads again. You're stabilizing there. And then once again, come with the goniometer. As you can see, she does have a little bit more. I have to adjust that down a little bit. And line that up with the head. And I can read that from here. I've got her at 74 degrees. So she does have more passive range of motion than active range of motion. That makes sense. She might have some limited passive insufficiency or active insufficiency that would cause that. And that is goniometric assessment of wrist extension.